Hey, this is Nick Herman. I'm going to be talking about the Salmon Creek surfer scenario. And to start it off, you have a 60-year-old man who is unable to paddle using his right arm. He then comes up to you slurring his words, but he promises he's not on any drugs or alcohol. So these would all be signs and symptoms of a cerebrovascular attack, better known as a stroke. Signs and symptoms of this include the slurring of the words, droopiness on one side of the body or that of the face, also visual impairment, dizziness, weakness. And how I would assess the stroke or cerebrovascular attack is using the FAST test. That is face, if the face is droopy. Next would be the arms, testing if one arm is not working or is drooping lower than the other one. Next would be speech, if the person is slurring the words or just not making sense at all. Next would be time, to see how long this is, each symptom has been between each other. Also, you could use the Los Angeles pre-hospital test, which is pretty much the same thing, just a couple more different questions. Next, how would I care for the patient? I would monitor the patient's condition, make sure that she's not drinking or eating anything. Try and get more emergency response by calling 911, and just offering comfort in total and reassurance. Now, if the patient is unconscious, you want to make sure that open the airway and make sure it's clear. Put him on a side lying position. Make sure that anything that is in the mouth can come right out, and just care for any life-threatening injuries as well. And you just have to sit there and comfort them as well. I mean, even though they're unconscious, you want to make sure that they are comfortable and not in any rough position. That should do it until more medical attention can arrive, and just taking care of the patient. Thank you so much for watching the video. Appreciate it. Bye-bye.